Hey, so we're going to run through some low back stretches. These are specifically stretch as opposed to exercises. We often do stretches first when there is an issue, because that will help to just loosen off some of the tissue and give the joints a little bit more freedom of movement to help heal. And then often we give exercises afterwards to just help control the joints and just strengthen up the muscles around there so there's more support. We often prescribe exercises, so when we run through any of the stretches here, if there's any pain, you change either the angle, don't go as far, or just change where it's less uncomfortable, and otherwise just stop the exercise altogether. It shouldn't be painful. It's not a no pain, no gain situation. So give these a go, not just for if you are in pain, but also as a prevention. So let's get started. So we're going to start on the back. We're just going to bring knees up to the chest, hold up for 30 seconds, and you should feel just a little bit of an opening into the buttocks and also into the low back. After 30 seconds, just lower one leg, keep the knee up. Once again, you'll feel that into here. If you start feeling anything into the groin, then just come off a little bit and see if you still feel that. If not, then you can just stop it altogether. But 30 seconds there, and then you're swapping sides there. From here, go with your knees bent, feet on the ground, and all you're going to do is just rock the pelvis like this. So you're keeping the pelvis contact onto the ground, and you're just creating an arch into the low back, so you can almost feel your hands go underneath it, and then you're flattening it. So you're putting pressure onto the ground. And do that a couple of times for about 30 seconds or so, just rocking the pelvis back and forth. Then from there, foot onto the knee here, and from here you can just bring the knee towards the opposite shoulder. That's going to stretch into the buttock here. Also might just get into a little bit of low back or top part of the hamstring on the outside, but it's just a bit of a stretch into this area, which will help take some of the pressure off of the low back and buttock and sacroiliac joint as well. So just a little bit of pressure, 30 seconds towards this shoulder. You can then alter the angle of this one and just bring it a little bit more across. You'll access different parts of the buttock muscle when you do this, so you can try doing that. And then after that, you can open up the hip a little bit more as well, just by pushing down, putting a little bit of pressure. Don't go over the top of this. This should feel comfortable. It shouldn't be painful again. Another 30 seconds or so for that one. Then from here, we can just do some rocking to the side. The knees bent. You can hold them. Often can put your hands straight across so you feel the contact with your shoulders on the ground. Try not to allow these to come up. Try and stay on the ground there. And back to the other side. If that feels comfortable, you can then just straighten one leg and bring the other over. And then a little bit more in advance, you can just put a little bit of a stretch over there. Once again, shouldn't feel painful, should feel like a stretch right across into the low back there, in the buttock as well often, and you obviously do that on the other side. So from there, we'll go on to the front, and we'll just do some stretches like so, coming up, and then arching the low back up. Up again, and down, like this. Do that for 30 seconds, and then onto the knees, like so. Stretching down, so palms reaching out far ahead. 30 seconds, again, 30 seconds. And then get onto the elbows. From here, you can just arch the low back up, bring the head up as well. You can feel that somewhat into the abdomen if that's quite tight. Often we are flexor oriented, so we will tend to go with these muscles tightening up and shortening. So just coming up like this to start with is a good way to start. And if that feels quite comfortable, you can always get into a press up position and come up like that, but still keep the pelvis onto the ground. So don't lift it up and pivot, just keep the pelvis onto the ground like this and arch up like that. Good. Then we can go on to the hip flexor. So the hip flexor, that's iliopsoas, joins into the lumbar spine and is pretty important for the function of the low back. So you can keep the knee like so and try to get upright. Try not to arch the back up, try to flatten it off a little bit. Try also to keep the knee in line with the hip and don't rotate the pelvis, so keep the pelvis facing straight ahead. Get upright, get that position, and you can either maintain that if you feel that stretch coming through here, or you can even mobilize it just coming forward like this. To get a little bit more advanced in it, you can either get onto just use the couch or use a bed, or if you have a Swiss ball, you can always get to the same position there, get upright, and that just creates a little bit more because of the angle into the knee. But get that position nice and straight again, flatten off through here, and you can either just come forward. That's a really good mobilization for the psoas. From there we can do the hamstrings, and there's many ways to do the hamstrings, but you can just get into position like this if you can maintain your balance, get upright and just rotate the pelvis. So it's not kind of just the back trying to get to the toes, it's getting upright and just rotating the pelvis, and you'll feel that stretch into the hamstrings. All of these you want to maintain, like I say, for about 30 seconds or so. You shouldn't need too much more or less than that, although they say how long you should stretch for is basically as long as it takes to stretch the muscle. So if it's a tighter muscle, you might want to spend a bit longer. If it's not so bad, maybe don't need to do quite as much, but certainly that's a good start to get things moving.